I'm Harold, physical therapist and director of rehab at Mind and Mobility. Thank you guys for coming in person and thank you for attending live. We're going to be going over bed mobility and transfers today. Okay, so I have a little presentation. You should have it there as well, and if not, we'll be getting it sent out to everybody. But the first thing I want to talk about when we're talking about bed mobility and transfers is just making sure that the area is safe. So you want to make sure before you even touch the patient, before you put your hands on anybody, you walk into the room, you have to make sure, let's look at the floor, make sure the floor is good, it's free of any clutter, there aren't bookcases or clothes or even animals on the floor. You want to make sure that everything is clear, everything is well lit, and your patient's in a safe place. So one thing that I've seen plenty of times as a physical therapist is rolling chairs, and I have one over here. Anytime you have a rolling chair, and it works for if it's a wheelchair as well, if it doesn't have brakes, don't consider using it. Even if it's against the wall, that can be a little risky because it gets pushed back and it can slide forward like that. So if it doesn't have brakes, just don't use it and get a chair that's fixed. And there are a lot of older adults that they just have rolling chairs, and you have to have the conversation with them to get chairs that are safer and that have brakes too. And then of course the wheelchair, making sure that the brakes are on. And this is something that as physical therapists, when we're working with patients, we make sure that they're aware that this has to be done regularly. So before they stand up to do anything, they check for their brakes, okay? So first things first, check the area, make sure there's good lighting, nothing on the floor, make sure they have brakes on everything, and then lastly, making sure that they have proper shoes. So I'm sure you've seen many patients before that they're just wearing socks. If they're the hospital grade socks, sometimes they're okay because they have the rubber cushions on the bottom, but even those, if they wear them all the time, they get a little dirty, a little dusty, and the last thing you want is to try and help somebody up, and all the effort you do, and then they just slide right down. So make sure they have proper shoes, proper lighting, brakes, and that's the first thing you do before you touch anything. Any questions on that at all? So Edwidge is a smart, strong young woman. Usually our patients are not very strong, and they're just much older and much weaker and less aware of their surroundings. So when you're going to get a patient out of the bed, the first thing you want to do is make sure that when you turn them towards you. So if I want Edwidge to come off of this side, I'm going to stand on this side. I never want to help her get up from behind. So if I want her over here, I don't want to push her from this side because then I have no control over her. So always want her to be on the same side, okay? And we're going to work with a log rolling technique. Log rolling techniques are helpful for anybody that has any back issues, which a lot of our older adults do. So the log rolling technique is just to make sure that they're not twisting so much through their back. And if they're not twisting so much through their back, it's safer for them and it's easier for you. So you want to make sure you're not having to work so hard. So what I'm going to do is I'm going to show it on this side and on the other side so you can see both ends. So I'm going to have Edwidge turn onto her side. And I'm blocking here, I'm standing right at her hip. So I know that I'm right in the middle and I can block both sides. I don't want to be too low or too high because you can see how she might slide from her feet, or if I'm standing over here, she'll slide from her head. So right in the middle, okay? And I'm going to have Edwidge bring her knees off the edge of the bed as much as she can. So just to show you, bend your knees here a little bit. So once her knees are there, I know we're getting a lot closer. So this is just what I look for. Turn onto her side, her knees are off the edge of the bed, and I want you to go ahead and start lifting up your head a little bit, and then your feet fall off, and I'm going to lift your head at the same time. Now, when you have heavier patients, that's a great way to do it. You have them tuck their chin a little bit, and you lift up by the base of their shoulder and move their hips at the same time. So you're doing this motion, okay? Go ahead and lay back down, please, Edwidge. You've been a great help so far, by the way. You're a tremendous patient. Go ahead and turn onto your side. Turn onto her side. I'm blocking this side. I should be right here at her hips. Her knees come off as well. What I don't want to do is start pulling with my hands, pulling just in the head, trying to do this. All that's going to put my back in danger. So it has to be a two-part. It has to be a push of the knees and a pull of the head. So the knees come off, and I lift the head at the same time. So this is the motion. Okay? Now I'm going to show it from the other side as well. So if you could lie down, please.
And we're going to sing together good night.
What is that?
Go ahead and turn towards me. Right at her hip line. Make sure the knees are off the edge of the bed. If she's too far to the middle, she can't get her knees, and it's going to be a lot more of a reach for me, and that'll be tougher for my back. Okay? So knees up, Lift your head for me, please. I get underneath the head.
Um,
Very simple. So again, this is the motion here. I'm not bending over to lift. I'm not grabbing. I'm not pulling by the arms. I'm not pulling by the head. I'm not doing just the feet and then the head. I'm doing both at the same time. Okay? Again, always blocking her off. How tall are you? And how much do you weigh? 5'11", 245 pounds of solid muscle. We're gonna lift them up nice and easy. So, and your name again? Eves. I'm Harold. So bring your knees off the edge of the bed a little bit. Lift your head for me, and get your feet a little further out too. Okay? Lift your head, and we're gonna turn. So a little harder, but 245 pounds, nice and easy. So you move the legs, you move the head at the same time. Once again, not bending over, definitely not rounding my back. Just gonna do both at the same time. Now, if the patient is still too heavy, you can have somebody do the head and somebody do the legs. So if you're feeling unsafe, if you're feeling just a little too heavy, then you can always have two people. Now, the next thing I want to do is go ahead and lay on your back. Say, for example, you can just lay face up if you don't mind. If you have a patient that has had a stroke or any sort of issues on one side of their body, so if Eve's left arm and or his left leg are affected and they're his weaker side, we're not going to get him up towards the weaker side. We want him to get up towards the stronger side, okay? Because if we try to go up from the weak side, he can't base with his elbow, he can't press down with his leg, so we want to make sure we're using the strong side. So what's something to keep in mind if you have a patient who just had a knee surgery, just had a hip surgery, where they have a long history of one-sided weakness, go towards the stronger side, okay? So, and you always want to protect all the joints as well, so if it's a hip or if it's a knee, just make sure you pay extra attention to that joint, okay? First thing you want to do before you put your hands on the patient at all, you want to make sure you check the area, make sure you have good lighting, make sure there's no clutter on the floor, make sure there's no animals nearby, just make sure the area that you're going to be working in, the place that you're going to, is going to be safe. So clear the area first. We also talked about moving the patient towards you, never away from you. Talked about standing at the hip line. And the other thing I mentioned was making sure that the bed height is high enough. You don't want the bed to be too low or too high. So right around your waist level is ideal, because otherwise you have to bend over a lot more, or you have to work from up here, and that's going to be a little bit harder for you. And we're all different heights, so hopefully you're able to adjust the bed. Okay? Then we talked about turning him and the technique that we use to bring him up to sitting. So we'll just demonstrate that one more time, and then we're going to go into the next part of bed mobility. So Eve, if you could roll towards me like you did before. Now again, Eve's a pretty big guy, 5'11", 245 pounds, solid muscle we said, it's verified. So we'll have him bring his knees towards me. So the knees are off the edge of the bed. So you want to make sure the knees are just off the edge of the bed, that way I know he's close enough to me. Again, I'm blocking him off, so if he overturns, I'm here to block him and make sure he's not going to fall over. Okay? So bring your feet off a little bit more as well. Lift up your head. So he lifts up the head, I grab by the base, and I grab by his legs, and then I'm going to rotate both at the same time. So as I push the knees, I'm pushing the shoulder and the base of the neck as well. I'm not grabbing by his head, I'm grabbing him by the base of his shoulder. So I do want to discuss one more thing before we get into the transfer up to sitting and then even to standing. So when you have a patient who is too low in the bed, especially you have it's a bed, and you can just stand a little bit off to the side so you can see me in the camera. You have a patient that's a little bit too low towards the foot of the bed. Maybe their feet are very much towards the edge, especially if it's a reclining bed, an elevating bed that has the headrest there, then you want to make sure that they're up. So ways to do it and ways to not do it. What you want to avoid is just grabbing him and lifting, because when I'm getting this flex and rotation, the flexion and the rotation of my back, it's going to hurt, and I'm going to be very weak in that position, okay? So you typically want to do this with two people. So what you'll do is you'll grab the sheet of the bed and ride by the shoulders and the hips, and you count together on 3, 1, 2, and if the bed is fixed, then it will work. So let's try that one more time. Ready? 1, 2. There you go. So now he's at the very top of the bed. So again, as far as preparation, you want to make sure that you have that extra sheet available to you. And you can grab a seat, thank you. You want to make sure that you have the base sheet for your bed and have another sheet underneath just for that. Now they do have sliding sliding sheets that you can use, but sometimes patients won't have that. So have an extra sheet available so you can use that to maneuver them around. I mean, and even if they're just a little bit crooked, you can grab the sheets and you can lift them from one side to the other instead of having to carry one leg at a time, okay? So the next thing I want to talk about is it's called orthostatic hypotension. So you might not have heard of that before, but you've definitely had patients that they've been lying down for a long time, they've been in the hospital for a long time, and they go to sit up and they go, well, I'm really busy right now. And you don't know when this is going to happen with a patient because maybe you haven't seen all their medical history, or maybe they didn't even know they had these symptoms. So what happens when they get dizzy is their blood pressure drops. Their blood pressure drops too much, could be because of dehydration, any kind of stroke, any history of any traumatic brain injury. Many different disorders can cause that drop in blood pressure. So you want to make sure that the blood isn't pooled, that the blood is flowing before you get them up to sitting. So one very easy exercise that I like is grabbing a leg. I'll grab the heel and I'll grab the knee. And I'm just gonna move back and forth like this. It's very easy. It's a great way to introduce yourself to. What's your name? One more time. Legisti? Legisti, I'm Harold.
Okay.
Nice to meet you. I'm happy to be your caregiver today.
Me too.
You exercise much?
Yes, good.
Good. This is nice, right? It's just like a little bit of a stretch.
That's a great.
It's easy for you. You feel like you're getting taken care of, and I'm making sure that the leg muscles are starting to move. That way, when I go to get him up to sitting, it's going to be less likely that he gets the dizziness. Okay? Now, even if you do this, you still might get those symptoms. So when you get him up to sitting, you always want to check. You don't want to go from laying down on your back, getting up to sitting, getting up to standing, get him to the bathroom all within a minute, because you could be standing in the middle of the room and then all of a sudden go, wait, that was really fast. I'm really dizzy right now. So you go one step at a time and you always check and then see, hey, how are you doing now? So we'll practice that. So basically turn onto your side. We'll do our same technique. Knees off the edge of the bed. Lift up your head for me. How do you feel?
Good.
Lightheaded?
Good.
Lightheaded, dizzy?
No, I feel good.
No dizziness, okay? And then we'll just wait a little bit here to check, because sometimes it's not immediate. It might take a few seconds. So let's just wait. But you're doing okay.
Thank you.
Oh, you can stay there. No. We're not going anywhere yet. There's no walker here. There's no chair. We have to make sure that everything is safe before we get him going. And again, just making sure the symptoms but he doesn't have any symptoms. Okay. So we talked about bed mobility. Of course, making sure the area is safe. Where we're going to stand, we're going to move the patient. Checking for symptoms when they're sitting. But if we're going to be getting up to standing, this is a patient that's going to be standing up, we want to make sure we have a walker. Especially if you've never worked with them before, have a walker. And they might say, well, I don't really use a walker. And I say, okay, well, that's fine. Let's just have one nearby, just in case. You don't want to be overbearing. You want to make sure that you're safe, because some patients don't usually fall when they have a walker. They fall before they have a walker, when they're not using a walker, right? It's like, I didn't know I needed a walker, and then they fell. They just should have had one already. So we're going to talk about how to help a patient up from sitting, okay? What's your name, please?
Nicole.
Nicole. So Nicole seems young and strong, so it should be pretty easy to stand up. But if she's not that strong, if she's an older adult, it's going to be a little bit harder for her. So easiest way to hurt your back is when you're having to lift this person and they're very heavy. So again, whenever you're doing the bed mobility, you start to get an idea of like, okay, well, let me see how well they're moving around. Let me see what their strength is like, especially when you're moving their legs. That way, when they get up to sitting, you kind of have an idea of how much effort you're going to have to put, okay? But if they have a walker, then it should be pretty easy if they're able to walk around and you know this already. So talk to the family as well, get some information from them. Now, things you want to avoid is just being at the wrong height. So I really want to be in line, head to head with her. I don't want to be too low, and I don't want to be too high, okay? If I'm too high, I'm going to have to lift her up like this. If I'm too low, I'm just not going to be strong enough to do it. So I want to be head to head. The other thing I want to do is if you scoot towards the edge, pull this bed a little bit high. The other thing I want to do is I want to watch her feet. So I want to make sure that her feet are not going to slide. So we talked about making sure we have proper footwear, that they're wearing sneakers, not socks, not slippery sandals. But I always still want to put some of my effort in there. So I'm going to stop at least one of her feet with my feet. So I'll put one foot in front when I go to stand her up. So I'm not going to stand toe to toe with her like this, but I'm going to have at least 1 foot, 1 foot blocking off, okay? So I'm going to be 1 foot in line, and I'm going to be in between knees with her. So I don't want to be perfectly like this, because then it's going to be hard for me to maneuver around her and she could slip. But if I'm blocking off this way, I can get low head in line, and that can help her stand up, okay? Ideally, you want to use a gait belt. If you don't have a gait belt, you just have to use a deeper grip from behind, okay? So you can work with holding onto one of their hands, holding them around their waist, holding them by their pants, or holding them by their gait belt. So Nicole, I'm gonna get around you, okay? So I'm gonna get around here, and she's wearing a belt, so it's perfect, okay? And I'm blocking off one of her feet and one of her knees, so I can make sure that she's safe. So I can go 1, 2, and up. And again, I'm gonna stand here. Nicole, how do you feel? You're very tall. Now let's get the walker over here. You look much taller standing up. So I have the walker here, and this whole time I've been holding on to her belt. So if at any point she says, actually I feel a little bit dizzy, I have her by the belt here, and I can sit her back down. And now I have the walker here in front of me, so she is completely surrounded by safety. Okay? Now Nicole is pretty strong, so you can go ahead and sit down. I'm going to do it the other way now too, just so everybody else can see. So you can actually go to the other side. Come over here on this side now. So ideally you'll have a gait belt, which is the thick belt that they can have around. But if they don't have that, just make sure you have something that you can hold on to. Nicole here is wearing a belt, so it makes it easy for us. We talked about blocking off the foot, standing in between the knees, so we can block off one foot but still have a bit of an angle. We also talked about head height. I want my head to be in line with her head. I don't want to be too low or too high. So I can get right around here, grab head to head, I'm blocking off one of her feet, and then I can help her stand up. Check and see how she's doing. I'm still having to let go of this belt because I don't really trust her, right? You grab a seat. If I don't know a patient, that's the worst. When you've been working with them for a while, you know what to expect. You know if your patient is going to be more likely to fall, less likely to fall, they're very good at walking, or maybe not. But if you don't know that, it's hard to trust them. And if you can't trust a patient, you have to be that much safer because you don't know what's going to happen. You don't know if they stand up, and maybe they're the impulsive type where they want to stand up and start walking right away. So you have to be able to have control of them so you know what's going on and you can take care of the safety of the situation. Does that make sense?
Yes.
Okay. So we're going to do a pivot transfer now, okay? Pivot transfers are patients that are weaker and really can't stand up on their own. So they're going to need help rotating. They're not really going to be able to spend too much time in the in-between. So the pivot transfer is we're going from bed to chair. Okay, so of course, this could be a regular chair, it could be a wheelchair, it could be a bedside commode. But the first thing you want to do is make sure that we have that chair and that it's on the strong side. So based off where we have the chair, it's safe to say that the patient's strong side is, which side would be your strong side? Correct. So, and if that were your weak side, where would I put the chair? On this side, on the strong side. So we always want to go on the strong side. So if this is her strong side, the chair's going to go there. If she had a left knee replacement, I'm going to put the chair over here. Left shoulder replacement, chair's going over there. Left-sided weakness because of a stroke, chair's going over there. Because I know that this is going to be the leg that we have to use and we have to rely on in that transfer. Okay? So that being said, we talked about the staggered position. That's the leg that I'm going to pay attention to the most. So when I get underneath her, get around her, make sure I have a good control of her waist, I'm going to rely on that leg and I'm going to use my legs to maneuver that. Okay? So I'm going to show you the maneuver just out here without any space. But I'm going to sit low, I'm going to lift, and I'm going to turn. So everything, you have to make sure that the space is there. And you want to make sure that this chair is nice and close so that you don't drop the patient onto their side. Go around this way, please. Thank you so much. So I want to make sure that this chair isn't too far away. And then I go to pivot transfer, and I have to sit them down on the floor. Or I have to sit them back down on the bed, and then move the chair. So make sure that everything is nice and close. It should be as close as possible, okay? And now, ideally, you wouldn't have an armrest. A lot of wheelchairs have the armrest that you can adjust off, so you might want to do that as well, okay? So again, we're going to get in line, head to head. I'm going to stagger around this knee on the chair side knee. I'm going to have my knees there. And I can even pinch the knee. If I pinch the knee, it's going to give me a little bit more control. So something to think about as well. So I'm going to get low right here. Head to head, I'm grabbing behind, I'm going to lift up, and that's it. So everything was nice and close. I see it right around that knee. I did a little bit of a lift, and I pivoted. Okay? So always talk to the patient too, always talk to the family, and get an idea like, hey, how do you normally do things? What works best for you? And then of course you have your experience, and with your experience you can decide what the best way to do things will be. Okay? Let's try that from the other side. So we'll just put this chair over here. So again, I'm going to get head to head. I'm going to be on the strong side, which is where the chair is. My knees are going to be around the strong knee, the inside knee. And I'm going to lift and rotate, of course making sure the area is safe. There's not too much space here. The chair is as close to the bed as possible and as close to her as possible. So I'm going to get nice and low, head to head, grab around the belt or the waistband, and I'm going to go up and back down. And the whole time, notice that, especially if they're weaker, I don't need to stand up all the way, then turn, and then set them down. I want to stay right in this position. So lift a little bit, and then back down. And then ideally the bed and the chair will be right around the same height. If they're the same height, it's just a slide. If the chair is higher than the bed, it's going to be a problem. So you have to lift them up that much more. So ideally they'll be in line. Does that make sense?
Yes.
Any questions so far? From anybody on Zoom?
Yeah, I saw some videos.
So this is a Hoyer lift, or at least one kind of Hoyer lift. They can all be a little bit different, but just so you understand how they work. And we're not going to fully use this one, but I'm going to show you how it works. So usually you'll have, right here on the back, there's going to be an up arrow and a down arrow. The up arrow is to raise this whole thing up, and the down arrow is to lower it back down. There's usually also a remote. The remote is going to have an up arrow and a down arrow as well. The next thing we'll have is the sling here, and you can see where it attaches. So here's your sling. So this is where the patient is going to sit. So this one in particular, you'll notice that they have the 4 loops, one in each corner, and then in the back there are some more loops. So this is for when the patient's elevated. You'll be able to hold on to these loops to help maneuver them. Okay? Now, the most important part of the Hoyer lift is making sure that the patient is secure in the sling. And where we're going to be able to do this is while the patient is on the bed. Now you have to remember, if the patient is using a Hoyer lift to transfer in and out of bed, then they're not really going to be very strong. They're more than likely not going to be able to walk. So it's going to require a lot of work on your part. It's always better to do this with 2 people, but it can be done with 1 person. It's just a little bit harder. So the first thing you want to do is get your sling, and they'll usually have something that says top. So if it says top right here, which it does, I know that this is going to be by the patient's head. And the lower hooks are going to be by the patient's feet. Okay? So, and I'm going to skip a couple of steps here, but once you have the patient set up in the sling, you'll hook all 4 points. And the patient should be safely in this space. So just to give you an idea of how it's going to look. Now using our remote control, we can raise them up, and then set them down wherever they need to go. And this turns as well. They usually have wheels, and this one in particular has a step here where I can adjust the wheels to go wider or adjust the wheels to go narrower. So that'll help you get through different spaces, or if you have to get around the legs of the bed, you can do that there, okay? So when you're getting the patient onto the bed, or onto the sling, you're going to have this right here like that. And if the patient's head is over here, you'll get it into the sling, you'll put this right over the top like this, you're going to have it nice and low so that it's slack, and then you'll use the remote control to elevate them off the bed. And of course, keeping an eye and making sure that they're nice and safe, and making sure that they're comfortable and not sliding towards your feet or towards your head or off to the sides, making sure they're secure. And you can do that and just make sure that when you get right to about there, when the sling is just off the bed, here's when you have to make sure that they're safe. Because here's still safe. If they don't look right, I can set them back down and I can adjust. But if you have them all the way Out here, you better hope they're safe already. You better hope they're nice and secure in that sling. So definitely make sure that before you get them out of bed, once you lift them up so that everything is just above the bed but still within that safe distance from the bed, that they're secure. Okay? Now let's go ahead and review how to use one of these things, how to get a patient into the sling. So first things first, the GC is here. I'm making sure that he's safe. I'm making sure that the space is safe. I have my Hoyer lift nearby. I know, and if his head's over there, I'm gonna have the Hoyer lift over here already. So I want to make sure that everything is already set up ahead of time. The last thing you want is to have one thing that you forgot and you have to leave the patient in an unsafe position, take care of that, and then come back and make sure they're safe. So first thing I'll do is make sure I have the head. I know where the head is, and I know that this is going to go underneath his back. So how am I going to get this to go underneath his back?
You put half of it,
Yep.
and you hold it down like a towel.
There we go. So definitely don't want you to go that way. I want you to go towards me. We talked about that too. So I'm gonna pull this over here, and I'm gonna push it as far underneath as I can, and make sure this loop comes onto the other side. So lift up your head for me, and I'm gonna push it underneath him as far as I can. Now we can do this a few times, but it's usually how it goes. I might not get it with just one roll, but I want to make sure that it is as deep as it will go there. Now go on your back. You don't have to go all the way over there. I'm gonna, while he's laying flat, not turn over the other way, I'm gonna pull out as much as I can. Okay, so he looks pretty good here.
Yes.
But if he didn't look good, if I felt like, it's there but not quite there, then I'm gonna say, okay, come to the other side, now you roll over towards me, face me this way, and then I can adjust back.
Exactly.
And I can do this, and I go flat.
Go there like a coffee cups.
I can do this as many times as I need to. Come, roll towards me, fix it here, fix it there. I can go back and forth, because I want to make sure that this is even. So I get these loops here. They're just, this one's a little bit higher, but they're just about even there. Head side, even. And you can see that the end of the sling is down by his knees. So that's really what you want. You want to make sure that the head is supported, which it is, and that the bottom of the sling is down by his knees. So I know that he's going to be in there pretty safely. Okay? Very safely. Let's be honest. Very safely. And then we'll loop him up to the top here. This would come closer, so I can get all the loops right up here. No, actually, it doesn't work. The batteries are not working, but I would loop one, then two, three, not quite. Have you bend your knees a little bit? Okay. So you can see his knees are already up. So if this sling were lower by his butt, his legs could still stay flat. If his legs could still stay flat, he's gonna end up sliding off. So I have to make sure that when we get to this position, his knees are up. So let me even lift this a little bit more, just so I know that when he comes up to sitting, he is safe. So here's another time to look at him. Get your last look. Okay, I haven't lifted him yet. He's still safe, maybe a little bit uncomfortable, but he is safe and secure, and he's on the bed here. And then we can start the lifting. Now this is a non-working machine, but this is the easy part. You have your remote. I can start to elevate him from here, and then I can control it and make sure that he's safe. And of course, wherever you're gonna take him, you want that to be nearby. I don't want to be carrying him with the Hoyer lift throughout the entire house, right? We want to make sure the chair is nearby. So it's just one quick lift, maneuver him over, then I lower it back down, I unstrap it, and you can even leave these slings on the wheelchair. I see people do that very often. So you might even consider having the sling and then put a sheet on top of it so he's more comfortable. That we can sit on the sheet on the sling, on the wheelchair. Does that make sense?
Yes.
So you have the wheelchair, then the sling on top, and the sheet on top of that, so that can stay there all day. And then when you're setting up the bed in the morning, you can also, if Logisti's taking a shower, then I can make sure that this is set up already, and maybe the sling is already spread across the bed, so when he lays down, he's gonna lay down right in the middle of it. So it's really all about preparation. You can prepare things ahead of time. It's gonna be safer, it's gonna be easier, it's gonna be smoother. Everybody will be happier. You can leave this sling on the bed ahead of time, and because it's a little bit rough, maybe you want to put something on top of it so that he's a little bit more comfortable, the patient's a little bit more comfortable, but still making sure the patient is nice and safe. Okay, if no other questions, I want to thank you all for attending. If you have any questions after this, you can speak to itself. We will be sending the presentation out. We'll also be having this video set up online, so you can have access to that as well if you have any questions. And we're happy to work with you, and thank you for working with us, and thank you for coming.
You're welcome.
Thank you all so much. It's been a pleasure.